Good afternoon and welcome to Dayton Children's parent presentation about the Pfizer COVID-19 vaccine for 5 to 11-year-old children. This presentation is expected to last approximately 20 minutes. We welcome you to submit questions at any time by clicking on the Q&A button on the top right side of your screen and typing in your question. We will answer as many questions as we can at the end of the presentation. We will end around 1 p.m. or earlier if there are no additional questions. This presentation also will be posted on Dayton Children's website and YouTube channel. We will do a second presentation with updated information from the CDC's review of the vaccine next week on Wednesday, November 3rd at 5 p.m. You can find the link to join on our website. Our speaker today is Dr. Adam Mezoff, who is the Chief Medical Officer for Dayton Children's. Dr. Mezoff, the floor is yours.
Okay, if we could mark down
Kristen, please mute.
Thanks very much, Stacy. It's a pleasure to be with you today. My name is Adam Mezoff, and I have the honor and privilege of being the Chief Medical Officer at Dayton Children's. Today, we'd like to give you some information on the COVID-19 vaccination in children 5 through 11 years of age. But first, I wanted to tell you a little bit about myself, because I think it's important that you know who's speaking to you in order to help better understand the perspective and the lens through which I see things. I have been in pediatrics for 40 years. I am a physician scientist. I have published more than 40 articles in medical journals, written more than 9 textbook chapters. I say that simply because I look at this information from the science standpoint in order to better present to you the facts as I see them. Now, next slide. But it's more than that. And what I'll tell you is I'm also the father of 3 children, 2 of whom are in this picture. My oldest, Ethan, is to the left, my daughter, Allison, to the right. And I am the proud grandfather of 4 grandchildren. Max is 3, but the girls you see, Olivia is 10, Harper is 8, and Isabel is 5. Are all in the age group where their mother and father need to consider whether or not to get them vaccinated. So I say this so you understand. I take this as a personal journey, not just that I'm doing this removed. So whatever I tell you, I would say or recommend to my own children and ask that be done with my grandchildren. So with that perspective, next slide. What we'd like to cover is a little bit about vaccines in general, talk about the COVID cases we see in children and how common and frequent they are, a little bit about the trials that have gone on to get us to the point we're at of considering vaccination for 5 to 11-year-olds. And then I would like to, at the end, give you a summary of what I see are the reasons to consider this vaccination, give you my recommendation, and then we'll start by answering some questions that have already been posed and then open it up to you all to ask more questions. Next slide, please. Vaccines have been around for quite some time, and in my 40 years in pediatrics, I would say they are one of the greatest advancements in science that I know of. On this slide, you see 14 diseases that have now been very well controlled with vaccination. I can tell you that because I've been doing this for quite some time, I've taken care of children with all of those illnesses. And I can tell you that those illnesses have caused a great deal of harm in children. And I am so grateful that we now have vaccines that help control them. Whooping cough, I'll use as an example. In a 3-month-old who hasn't been vaccinated and gets whooping cough, they can literally cough themselves into bleeding in their brains. So vaccines have been a huge help in preventing serious problems in children over the past 40 years. Next slide, please. There have been a lot of questions about this current vaccine, and we're talking primarily about the Pfizer vaccine, which is the one under consideration for 5 to 11-year-olds. Pfizer's vaccine, along with Moderna's vaccine, is called an mRNA vaccine, and M stands for messenger RNA. The way this works is the following. RNA, think of it, it's really the blueprint that tells that factory in your body that makes proteins what protein to make. The protein it makes is called a spike protein, and this is a protein almost solely seen on the virus we call COVID. So what your body is doing by getting this vaccine and making this protein, it's preparing your immune system to see this germ in the future. So by the time it sees this germ, it is able to handle it without you getting very sick. So the immune cells get revved up and start making antibodies to this spike protein. So again, when a virus is introduced with this spike protein, your body automatically knows how to handle it and can do so very easily and quickly. Next slide, please. While mRNA vaccines are somewhat new on the scene, they really aren't new in the science world. They've been under research and under development for more than 20 years. There are other uses for this technology, including future cancer research. But most importantly, I want to tell you that mRNA is rapidly dissolved in your body once you receive it. So it can't change your DNA. The protein that it helps the body to manufacture is not alive, and you can't get COVID from it. And I know those are questions and concerns that folks have had in the past. Next slide, please. So what about cases in children? Well, this data is like a lot of the data we get from the Center for Disease Control. And this shows that once the Delta variant hit, there has been a huge uptick in the number of cases that we see in children. In fact, if you look at the data from June to July and compare it for August and September, the number of cases went up by more than 400%. Clearly, the Delta variant was a game changer for children. Next slide, please. So about 1 in 4 of all COVID cases currently in the country are in children, but children only make up 20% or so of the population. And so why, you may ask, is there more COVID in children now than there used to be or than in other populations? A lot of that has to do with vaccination. So those of us in my age group and the adult population have been vaccinated, so there's less and less COVID in our age group, and therefore more and more in this age group. Next, please. And we know that children can get COVID, but often we hear they don't get sick. And while we are very fortunate that they often don't get very sick, children can get very sick from COVID. So overall, about 3% of the children with COVID in Ohio have had to be hospitalized. Again, the Delta variant has changed a lot of this. We are fortunate that October is starting to get a little better, but it's still a lot higher than it has been previously. Next slide. And more, what we've learned is that a third of adolescents who have been hospitalized for COVID end up in our ICU, which again means they're very, very sick. And 1 out of 20 of these folks will end up on a breathing machine. So again, much more common in the adult world. And while maybe 6 months, even a year ago, we might have said children don't tend to get this sick, the Delta variant was a game changer, and now children are getting almost as sick as the adults that we see. Next slide, please. We've often heard the comparison to flu, and this slide gives you a little bit more information on what actually happens with that. So if you look from the beginning of this year, there have been almost 800 pediatric deaths due to COVID, compared to what on year averages for flu, which is about a quarter of that. And thankfully, because of vaccines that we pointed out previously, there are very few deaths from those disease entities we now have vaccinations for. Next slide, please. So what about the Pfizer trial? What about this specific vaccine? Well, we know children's immune systems aren't quite the same as adults, so it was very important that we have a trial that had this age group in it. And the results have shown that there's a very strong immune response to this vaccine. In fact, so much so that we can cut the dose down to about a third of what adults get and still get a very robust response. The trial actually was with more than 4,000 children, but of those, about 2/3 got the vaccine. So about 2,200 participants aged 5 to 11 got this 2-dose vaccine regimen. Next slide, please. And it was shown that this is very highly effective. In fact, the expert scientists around the country that reviewed this for the FDA, which is the first step in authorizing it, voted 17-0 with 1 person abstaining to recommend the emergency use authorization of this vaccine. It is more than 90% effective, and we'll talk about the safety in a minute. I will remind folks that it is next week when the final approval of this may occur. So what about the safety? We got in contact with Dr. Bob Frank, who is an infectious disease expert and researcher at Cincinnati Children's, and he had been a part of the research trials in children this age. He had several statements, the first of which is that one of the reasons that this vaccine is felt to be safe is because there have been literally hundreds of millions of doses given to adults and teenagers in this country. And sometimes people say, well, gee, has the vaccine been out long enough to feel comfortable? Part of the reason the answer is yes is because it often takes 10 years to get the same number of people getting vaccinated with other vaccines as it has taken to get people vaccinated for COVID because of how ubiquitous, how it's throughout the world. And Dr. Frank's thought is that if we haven't seen anything with these hundreds of millions of doses, other than what we'll talk about, it's very unlikely we're going to see anything new in the course of the next few years. So does it work? Because if it's safe, but it doesn't work, it's still not helpful. Well, yes, it is very safe. And they've done several in-depth immune studies on children's 5 through 11 that have shown that they have a very similar response to those older in their reaction to COVID once they've had this vaccine. And what I find of interest is that despite the fact that for a while now we've had the ability to vaccinate 12 to 17-year-olds, there have been no children admitted to our hospital to date. This can change. There have been no children admitted to our hospital to date that have been vaccinated. Next slide, please. So side effects, certainly a big consideration. And I understand this is a hard decision for folks to make. You have a very important job in making sure your children are safe from disease and harm. And so this is something that I thought people would be most interested in. It turns out that the side effects that we see basically mirror what we see in adults. Most commonly pain at the injection site, sometimes some headache or fatigue, less commonly are fever or chills, and all of this typically resolves within 2 days' time. Next, please. There has been reports of something called myocarditis. I think it's really important we talk about this. Yes, that's exactly right. There are reports that there can be inflammation in the heart, but I think there are several important things to consider about this. That in the trial with 5 to 11 aged children, even though there weren't a large number, there was no myocarditis seen. Secondly, this occurs infrequently. In fact, it's less than a few per 100,000, which means that there's an overwhelming chance it will not happen. And finally, that the cases that have occurred, and often in teenage boys, were mild, resolved within days to a week, with some minor treatment such as ibuprofen. And I might make one more point, which is that it turns out that the chance of developing myocarditis from COVID, from being infected with COVID, is far greater than the chance of getting it from a vaccine. Next slide, please. People have often asked, well, if I get this vaccine, can I get others? And the answer is yes. We have had plenty of experience now to know that you can get your flu vaccine and your COVID vaccine even at the same time should you want to. There isn't a lot of flu in the community yet. It is coming, so it's important to get your flu shot. But if you're weighing whether or not you want 2 vaccinations at once, consider the COVID vaccination only because it's still much more common right now than the flu in our community. Next slide. So now the important question that you all have to answer, should you get your child vaccinated? I would tell you that I believe it's a good idea and an important thing to do, and I would put into 3 broad categories. The first and most important is protecting your child. It is always important to prevent a disease that can be prevented. We have learned again with those vaccinations through the years, the importance of vaccination in keeping children safe and keeping them healthy. This is another example of that. It limits the out-of-time learning that they would have had with school. It limits the time out of extracurricular activities. And I'll remind people, while it's uncommon, there are long-term side effects to COVID in adults and children. Long COVID does occur in children. We call it brain fog, trouble concentrating, headaches. So there are reasons why vaccinating them protects them and helps them to stay healthy. The second reason is your family, and only you know the challenges that you face with your family. But many are extended families. And remember that by limiting the amount of COVID in children, we limit the amount that gets to siblings who may have chronic illnesses, grandparents, cancer survivors, even teachers they may come in contact with. So it does protect your family and extended family. And again, extending that further, the community as your extended family, it not only helps get us back to normal quicker, but the better we do in vaccinating, the less likely we will develop more variants down the road. So there are several reasons why I think you should consider this. Next slide, please. When the vaccine, and I think it's a when, but if and when the vaccine is approved, we at Dayton Children's plan to be as available as possible to you. We will have clinics available after school, Monday, Wednesday, Friday on the main campus, Tuesday and Thursday on our South Campus, and Saturday back at our main campus. These will be through appointments through the standard state appointment system, but we want you to know that we will be ready and willing to help. Remember that there is a limit, an age limit to which pharmacists are allowed to vaccinate. And so while many of our commercial pharmacies may help out, there is a limit to the kids that they will be able to help with. So we will try and be as available as possible to you in getting this vaccine available. Next slide, please. We've talked with schools. At this point, we are not pushing them out to the schools. There are several reasons. One is the younger age group really does need to be with a parent at the time that they're being vaccinated. There are ways that we can make this easier for kids at our institution. We have Child Life, we have the other distractions that we can use to help out. So given that and the resources available, we think right now we would encourage folks to consider coming to our campus to get vaccinated. We are also happy to help support primary care doctors' offices in their efforts to do this, and that's certainly a great place to have your child vaccinated. But if there's a challenge or a problem in any way, shape, or form, let us know. We want to work with you if you want your child vaccinated. Other things to know, again, how to treat this. You all are the experts at your children and how to do this. You know, when you go to the doctor's office for their vaccinations, you have to tell them the truth. It may hurt for a minute. You help create distractions. We are always celebrating the fact that they got through it and did okay. We know that children, even adults sometimes may cry with these, and that's okay. Everybody handles it differently. We just want to make it as good an environment as possible so that when they get vaccinated, they can do it with the least amount of stress possible. Next slide, please. Well, we're going to get to your questions, but there were some that were submitted already that we wanted to get to. So once again, there's a lot of questions about side effects. I hope I've answered them. Again, about what is common, what isn't common, and the question about myocarditis. Again, even though it's not in the trial, and the trial isn't a huge number, knowing what we know about the children, the adolescent males who've gotten myocarditis, and I know this based on several things. One is I literally read 1 to 2 hours a day on this subject. I feel like that's important for me to do, so I am staying current so I can help protect our hospital as well as the children in our region. When you do that, and I've also had a chance to talk with our pediatric cardiologists, they would say the same thing, which is this tends to be very mild, self-limited, and so they still encourage folks to get vaccinated. Next slide, please. I've also heard something to the effect that we do this to make money, and I just need people to know that just couldn't be further from the truth. There is no charge for these vaccinations, but think about the fact that it has taken large groups of our folks many hours for the logistics to be planned, for pharmacists to help organize us, for our nurses to administer these. None of these are charges that we pass along to people. So we actually lose money doing this, but we think it's such an important community benefit. We are more than willing to do this. But I just needed to get that out there because we have heard some questions along these lines, and it really couldn't be further from the truth. So with that, I'll stop my presentation and open it up to questions.
Great, thanks, Dr. Mezoff. And for anyone who would like to ask a question, I think you just utilize the Q&A at the top of your screen and submit them there. In the meantime, we'll get started on a few questions that have already been submitted. Going back to the question around side effects, there's a question about infertility and concerns around fertility issues in kids that may receive the vaccine. Could you speak to that a little bit?
I can, and I think that's an important question. It's certainly one we've heard before. And what I can assure you, based on all the data, all the information, and the national societies that deal with fertility, obstetricians, gynecologists, is there is no tie to fertility issues. That is not an effect of the vaccine.
Okay, great. Another question is, why is this necessary for a healthy child that has no pre-existing or underlying condition?
I think that's a great question. And part of the answer is what you saw with the data that we've shown. Another is that at least a third of the patients we've admitted to the hospital with COVID haven't had any pre-existing conditions. So unfortunately, even without them, it can cause trouble.
Couple questions around kids that are under 5, but weigh about the same as a 5 or 6-year-old may weigh. So if a 4-year-old wants to get vaccinated and is a bigger 4-year-old, are they able to get vaccinated, or do they need to wait until they turn 5?
Unfortunately, the answer is they need to wait till they turn 5. And remember that in order to register, we need a birthday and all of those sort of things. So while I appreciate the fact that many folks would like this done as soon as possible with their children, it would be best to wait until they attain the age of 5.
If you have a family history of heart disease, are the heart inflammation side effects of the vaccines of particular concern?
I would say no, that I would remind folks that the chance of having heart inflammation is greater with getting the infection than getting vaccinated. So in many ways, I'd actually say that's a reason to get vaccinated.
Okay. A question that just came in here. Do you recommend the COVID vaccine for kids that have had COVID?
I think that's a really important and a great question. And the answer today is yes. And the reason is the following. At least in the adult information we have, if you look at national statistics, you are still twice as likely to get COVID if you have had COVID versus if you've been vaccinated. So again, the protection from vaccination at this point still seems to be as strong or stronger than having gotten it. So if the goal is to protect your child as best as possible, I do think it's a reasonable course.
One question that was submitted prior to the meeting today was, my child has asthma, so we've been extra careful, but have been in the ER for croup and whooping cough due to asthma. Is this vaccine safe to give my asthmatic son, and will he likely have adverse side effects as a result of the vaccine?
And the answer is it is safe, and the vaccination itself doesn't necessarily cause trouble with asthmatics, but I will remind you that asthma is one of those conditions that can be harder hit with COVID than children without asthma. So once again, as in the discussion previously, it would probably be very important for asthmatic children to get vaccinated, in part because they may have a harder road with COVID than children that don't have asthma.
Okay, with Moderna coming soon as well behind this vaccine, just as it did with adult vaccines, what do you recommend for those who would rather wait? And there's another part of this question. Also, what is the data and trials showing with children 5 to 11 in the Moderna trials versus Pfizer?
To date, from the things that I've read, they are pretty comparable as far as the data is concerned between Moderna and Pfizer. I have personally had Moderna, and I think it's a great vaccine, but in all honesty, so is Pfizer. There's a lot of worldwide experience with Pfizer. There's an advantage to the fact that there's more experience with Pfizer than Moderna. I would tell you, I think either vaccine is very good. I would also remind you that it is now okay to, quote, mix and match vaccines. So once you have gotten your full series with Pfizer, as the need for a booster may occur, if you would choose, you could use Moderna in that circumstance. My concern in waiting is simply we don't know how long it will take, and every day not vaccinated is another day where you're more likely to get infected.
Another good question that just came through. What if your 10-year-old weighs as much as a 12-year-old? Should they receive the same dose as a 12-year-old?
I think that's a great question. I smile because I have personal experience with that. But the answer is you should still go by the age groups as they're stated. The weights in per se were not pulled out of the study to understand whether they would do weight-based dosing. It's all age-based dosing in the trials, so I think it would be best to stick with how it was done in the trials.
And I think you addressed this in your presentation, but is it safe to get the COVID vaccine at the same time or close to the flu vaccine?
It's an important question. Yes, it is safe to do both. I have done them within a week of each other personally and have not had too much trouble, although it's been a while since I've seen the age of 5 or 11, but I do think it would be safe.
Great. So those are all the questions that have come through so far. If anyone has any last call for questions here, please submit them in the Q&A at the top of your screen. I'll give it another minute or so to see if anyone has any additional questions to ask. All right, no new questions have come in yet. And as I think Stacy mentioned at the top of this presentation, we'll be collecting all the questions that have been asked and turn them into an FAQ on our website. So if you want to dig into a little more detail of what Dr. Mezoff shared today, those answers will be on the website.
Yes, thank you. Yes, thank you everybody for joining. And remember, we'll do another one of these next week. So you can find that link on our website. Thanks everybody for coming. Have a good day.